Good morning, everyone, or afternoon, wherever you might be. Yes, my name is Marilisa Mancao. I am at an FQHC in the Bay Area of California, Access Community Health Center. I am a family medicine and integrative medicine physician doing group medical visits for menopause and menopause.
Thank you so much. And then I'm going to go ahead and pass it over to Megan.
Hi everyone, my name is Megan Pfiffner. I'm a CNS which is like a registered dietitian, slightly different set of credentials. So I work in the integrative and functional space, providing perimenopausal care within the functional through a functional lens. And I live in Brooklyn and work virtually. So I work with people all over the country.
Thank you, Megan. We are here today to talk about the whole woman. And so, for a lot of people, perimenopause, menopause, it all arrives as a surprise, right? Whether you have hot flashes that you're told it's just stress, or irregular cycles that you're told to ignore, or good old brain fog, right? Brain fog happening just because you're getting older. Let me just tell you that's not the case because I'm 32 and it's happening to me. But but these are the things that we're told, right? And so today's panel is really about what happens when people decide what we're hearing or receiving isn't good enough and where to look to. And we have Marilisa from Access Community Health, talking about what they're doing to reach out to their communities, and what Marilisa is specifically doing in her work, along with Megan, who's literally been meeting women where they are. And so we know that this gap is real. We know that it's tough to just kind of get these things together. And so both of these individuals just make up something that we don't see often enough. And that's just a full picture of what it is to show up for the whole woman. I don't want to say midlife. I'm going to try and stay away from midlife. So we can call it whatever you want, right? Wisdom years, second spring, internal furnace, private summer, whatever you want to call it, right? And so that's what we're going to talk about today. So my first question, and I'm going to start with Megan. What was the moment that you realized the women in your community were navigating perimenopause almost entirely alone? And like, what made you feel like you needed to do something about it?
This was very personal for me. During the pandemic, New York shut down, and I had owned my business for over a decade. And because of that, a lot of my work got taken away. And the following years, I was on Medicaid in order to cover that, because when you're paying New York rent, you don't have employer provided health insurance. Things get pretty expensive when you don't have any way to bring in money. So I experienced what it was like to try to access care through Medicaid in New York. And it was very challenging because when I got to a place where I needed perimenopause support, I hit a wall. There weren't any practitioners that I could physically get to that had the skill set and the training to help me. And so there was nothing for me to do within that context. So that led me to believe that there's got to be more. I can't be the only one. And there must be some way that I can start providing this care. And so I started educating myself from a diet and lifestyle perspective on what I could do and figuring out ways to work more within the community in Brooklyn.
I love that. Not that I love that in the way, pandemic was rough for everyone, but I love that you're just going through it from your own lived experience. And so I'm going to also pass it to Marilisa. Same question. What was the moment that you realized when women in your community were navigating perimenopause almost entirely alone?
Yeah, the very many moments that just kept adding up, right? Especially after the pandemic, when we weren't in person and some patients lost whatever kind of relation they had with their medical provider, that we started saying, oh, let's go to the cardiologist, let's go to the rheumatologist, the orthopedic doc, all the pattern of referrals that I see my many patients. And I step back and say, why are we feeling so broken, right? When we're not. They're going to the allergist, the dermatologist, all of those things, physical therapy, urology for all the UTIs. What is happening to us, and can we pull back and see a bigger picture? Can we see the pattern? And then, of course, for me in my own life, going through my own perimenopause and menopause journey, it really opened my eyes. And thankfully, Dr. Mary Claire Haver is an OBGYN who wrote a book that mirrored my own journey, even as an OBGYN doctor, even as a integrative medicine doctor. I didn't know how to deal with it enough. There had to be more. And I wasn't really taught that. OBGYNs are taught that bikini medicine, right? The breasts and the pelvic area. I was taught whole person perspective, but um, at the time, and that was, few decades ago, we didn't appreciate all the science of where estrogen is in the body. So lots of data points, lots of reasons to
Yeah.
continue on the journey.
And was there like a patient encounter, or I know you're mentioning data points. You might hear my dog in the background. Sorry in advance. Um, but was there a specific like patient encounter that just really made you, aside from your own experience, just continue to follow through with this?
Yeah, sorry, is my volume too loud, Stephanie? Oh, I don't know if you're resonating or just the sound I see in the chat. Um, yeah, one patient, and she'll know if she listens to this later. Um, she did not say no when the orthopedic doc told her you're fine. When the rheumatologist said everything's fine, it's all in your head. Right? When the urologist said it's all in your head, everything is fine. And she knew that she wasn't, that there was some reason. And as we ruled out everything, made sure it wasn't thyroid, anxiety, depression, all the things that we checked her cholesterol, her ASCVD score, all those things. What else is left, right? This big gray area. Patients are like, am I normal or am I abnormal? And everyone's saying, everything's fine, but they know they're not normal. What is this space? And so, yes, there was one patient in particular, she just would not accept that it's fine. There's something else. What else? What else? And in researching for her and researching for myself, now that she decided to do menopausal hormonal treatment, her shoulders are unfrozen. The frozen shoulders, she feels like she defrosted, right? All the fascia that was tight, the bones, the thinking that was so tight in her brain. To see her journey is also why I started my own hormonal treatment. She had such a beautiful uh, thawing. Um, so, yeah,
Quite literally, right?
amazing.
Because of that frozen
Literally.
shoulder. That frozen shoulder.
Yes. Carpal tunnel, right? Everything, the estrogen that's in our muscle, bones, joints, fascia, it misses the estrogen. And what happens? We don't move. We don't have that liquidity that we used to have when estrogen was abundant during puberty or during pregnancy um, yeah, there is a transition for sure.
Yeah, I appreciate that insight, and I'm gonna transition over to Megan too now. So, like, what was it like for you to recognize this gap, and just, like, make the choice to address it?
So I think that as I met more women who were experiencing this, no one was really naming it, but there was a common constellation of symptoms, just like Marilisa was talking about, where they would go to a neurologist because they think that they're having early onset dementia, or they think they have Alzheimer's disease, or they're in pain everywhere, and they think that they have some crazy chronic condition. And as I'm listening to these women talk about this, and within the clinical context, seeing women with these similar patterns where they have this long list of referrals and different doctor's visits, and zooming out with the education that I had, saying, hey, this doesn't seem like these orphan things are all separate situations. It seems like they're actually all tied together. And if you look at it from the broader lens, there is this perimenopause picture, especially when we put it in the context of life stage, what's happening. And if you think about all those things and connect those dots, it changes the conversation that you're having. And so if I can educate women just during a nutrition session or during a community education and say, hey, all of these things are connected. There's this common thread of this step down of your hormones, and there are estrogen receptors everywhere in your body, in literally every cell. This is a huge piece of the picture, and getting them to understand that, it changes the context of how you're feeling. There's less anxiety, there's less fear, there's understanding and knowing that there's something that you can do about it. And I think that knowing that that education common thread piece was so important for the women that I was able to share that with, that's what really made me decide to spend more time learning, educating, and sharing with the community, and trying to address it, because it's too challenging in these siloed spaces to get everyone connected on the same page.
Yeah, there's definitely like a communication gap within all of this, right? And just learning how to really like just come together and whole as a community and go from there. So, Marilisa, I'm going to ask you this. Most of the patients in the safety net don't even know that their primary care home can support them through this. So, how has starting the conversation in general, or even using CareMessage, like how has it changed the trust factor between your patients and clinical team?
Yeah, education number one, right? Uh, so that they know what's going on. If we reach out and say, hey, you're not alone in this, uh, can we find a way for community to talk and be in relation? So, um, my primary care colleagues are very, very busy, right? In 15 minutes, they have to deal with the diabetes, the cholesterol, the anxiety, depression. They're managing the meds, ordering the tests, making sure that all the care gaps are filled. When do we have time to actually talk or listen? When do we have the time to educate? When do we have time for a woman to just lay it all out? Doc, this is all I'm going through. Here's all the things, right? So we're new to using CareMessage for this, but we reached out to women, and women are saying, oh, yes, I don't have a time to talk about this. We never get to talk about what matters most, right? So that's part of the integrative medicine whole person lens. What matters most to you?
Do you feel like there's been, a little bit of relief or surprise, or has there been any resistance towards, like, this process when introducing this?
Uh, so it takes a lot of time to do this. In a 15-minute visit, it's not going to happen. You need minimum 15 to hear a patient to even put out the words. And so I found, instead of saying this thing to each patient, that the group medical visit setting is so much better for this, right? So I get to say it to, 8 to 10 people at a time. And then the crosstalk of women saying, yes, I tried that. Yes, I feel like that. Oh my gosh, I thought it was just me, right? You too? You don't look at this is what worked for me. I did more protein, I did more fiber. These are the strength training that I did. And Dr. Mancao said, just move and dance while I'm brushing my teeth, right? Um, all those little things uh, have helped. I'm sorry, did I answer that question for you?
Yeah,
I
I
can
think
go
so.
off.
No, I think what I'm hearing is ultimately there's just relief that people are able to be in a space and understand each other and talk about what they're going through together. Um, again, this whole entire event is based off of really building community in general. So obviously you're having this moment or this time where you can provide this space with 8 to 10 women that they can talk through things together and not feel alone, right? I think there's a lot of, and I'm gonna, in the chat or whoever wants to say, like, I feel like since the pandemic, community has been a little bit intense, right? In a sense where it's like, it's harder to reconnect or find people, and there's just been that kind of loss of time where it's like, what do we do and how do we get together and how do we talk about what we're going through all together? So no, I totally understand what you're saying, and I appreciate you. So Megan, I'm gonna ask you this question. So you've built expertise in perimenopause and you are super, super knowledgeable in it. And so can you talk about what most women are hungry to understand?
Yes, I think that just building on what Mary Lisa was just talking about, getting women into a group setting and having them understand and be able to cross communicate. So providing the education of what's happening in their body, because this it's not like you get a little letter in the mail that says, welcome to perimenopause. These are all the things that you should think about happening if there's no memo, right? So we're just sort of going through this blindly. And I grew up in the American South, and the education on just what was happening to your body was very lacking. It was very abstinent and fear provoking. And so if you didn't learn what was happening to your body to begin with, when it starts unwinding, it can be very confusing. And so the idea that your UTIs and your brain fog and your gut health and the new onset adult acne that you're having and the problems with your sex drive, in addition to all of a sudden this new PMS that's existing, all of those things are connected. And having someone say, yes, that your experience is true, it is real. These things all have a common cause, and we can work on them and address them. And often addressing some basic pillars, like Marilisa was talking about as well, like sleeping, moving, eating things that are going to support what's happening. Once they understand that these things are all connected and that they are not alone, that aloneness is so important. And like you were talking about with COVID, just that the access to community has gone away. And so bringing women back and getting them to have conversations, whether it's in person, virtually Zoom, or even in some WhatsApp groups, just being able to know that there are other people that are having a shared experience. You're not crazy. Your brain is not developing Alzheimer's. You don't have dementia. There's this transition, and there are things that we can do and we can address it to support you now. But this moment is so pivotal because it's setting women up for the next 30 years. And so we want them to understand that so that they realize that what they do now is going to impact what the rest of their years are like. And we want that to be full of joy and movement and being able to spend it doing the things that they want to do and not in a gradual decline because they didn't address things now.
Oof, I'm about to pause and go stretch and do some things. I'm like, oh my gosh, like, there's no way I gotta start moving. In addition, Megan, too, I would love to know, since you're already touching on like things to set yourself up for, can you talk a little bit more about like the nutrition and lifestyle factors that you wish were part of like a conversation, or like a care conversation in general?
Yes, of course. And I think that Mary Lisa really tapped into the big problem here, which is that most practitioners have 15 minutes to go over absolutely everything. So, how do you drill down to these lifestyle and chronic condition pieces? And not that perimenopause is a chronic condition, but this transition, when not addressed, leads to a lot of the chronic conditions that we have. So, I think that one of the biggest nutrition pieces is consuming enough nutrition. And so, within this current food environment, it is possible to be overfed and undernourished, meaning that there's lots of convenience foods, which I think are necessary just in life in general right now, but understanding what are they taking up a space from and what are they taking away from, and how can we start making choices to put more nourishing foods on the plate that are going to support that insulin resistance. Because as we start transitioning into perimenopause, independent of age and weight, we do become more insulin resistant with that step down in hormones. And so educating women on that and letting them understand that they need to be eating enough. Not enough nutrition is a stressor on the body, and that stress piece plays a role in how your body is purchasing resources. We don't want your body to choose, do we fix the hair or do we fix the gut? Obviously, your body is smart enough to choose the gut. We don't want your body to make that call, right? We want it to have enough that it can do what it needs to do. And I think that the stress nervous system piece is also really important because when we're not consistently having meals, when we're not consistently getting enough nutrition, when we're not sleeping well, when we're not moving our bodies, all of these things are stressors on the nervous system in the body. But the woman sitting in front of you may not even register that she is stressed because she's used to managing the mental load so well. She doesn't notice the signs that her body is giving her that it can't keep up. And so figuring out a way to address that piece just with 5 minutes of breathing or meditation, just even being aware of the fact that when she's not sleeping consistently through the night, that wake up that her brain turns on and starts thinking about things at 2 a.m. Part of that is a nervous system factor. Her body is like, oh gosh, there's a threat. What is the threat? I have to address the threat. And there's not a bear in her room. We're not we're not at that stage. But if she's waking up and her brain is constantly scanning for threats, she's not sinking down into deep sleep. She's not getting rest. And so this nervous system stress piece and this nutrition piece tie into a lot of the chronic conditions that women start to develop after this transition. They catch up to men in many of those ways. And we don't want them, not that we want our men to go the wrong way, but we want to hold on to that at that distance that we have ahead of them and keep going, right?
Totally agree. And Marilisa, I see you nodding your head. Did you want to add anything to that?
Oh my gosh. Um, hmm. Just in our populations that we serve in a lot of the FQHCs, CHCs, tribal places, as I talk to women who are usually immigrants from other places and say they don't have the corns, beans, squash, or the veggies and the fruits that they had in their home countries, that their indigenous knowledge from what they had in other places, native to their cellular DNA, that they're having to depend on the food that's here. that doesn't have the vitamins, minerals, that even in the setting in which we have our food, right? When we were so much more relational, we ate with bigger families. The culture here has made all those things worse. We need all those things. In an ideal world, we would have the sleep, the community, the food, the movement. Uh, but especially in this perimenopause, menopausal transition, where our brains are reorganizing. The neurotransmitters in the brain are reorganizing along with the estrogen, where our bodies are changing, the midlife middle waistline that's increasing. Those are all things that need this physical change. But where is the other stuff, the relational, the good stuff behind what is the food, the protein, the fiber, right? Where are we walking together and playing together, sports or, um, yeah, just hanging out in large groups? So there's a lot, right? And especially in our communities, how do we give culturally competent care? It's hard. I don't know them all. I've been fortunate to work on the Navajo Reservation 20 something years. I am grateful for the communities I've served in the East Bay area of California. Lots that I'm learning about, and it's ever learning. Um, and then how to adapt. What is the best of Western science, and how can we integrate that with indigenous wisdom?
Yeah, this is clearly a common theme amongst our conversations, even in the last conversation that Cecilia and Sanan were happening, right?
Mhm.
Or talking about, not happening, hello.
Yeah.
But just mentioning like understanding, cultural differences and defeating implicit bias. And it's just it's definitely a conversation that we're going to continue having. And also Three Sister mention, love to hear
Woo,
it.
yeah.
Um, we shameless plug after this session, we are having Mariah Gladstone, founder of Kitchen. She's going to be talking about a recipe for resilience. So shameless plug here, but I'm really excited that it keeps coming. Like it was also mentioned in the first session before this too. So I'm glad that everyone's pretty much on the same page. And before I move on to questions, I know I was going to hold off for questions towards the end, but I want to just make sure that they're still relevant in the conversation. So I'm just going to hit one from a new coming through always. Even today, OBGYNs do not address issues beyond pelvis and breast conditions. What will be the message to all providers that it has to be a whole patient care? Marilisa, did you want to? I see
Oh
you
gosh.
breathing through that already.
I breathe from my fellow OBGYNs. It is hard. How can you get the woman up in stirrups and perform a pelvic exam in a non-rushed manner and still have the conversations? How do you talk about maybe what's on their last pap smear and why you're doing this and whatever else? It's hard. I don't know how. And so I'm very grateful to Access Community Health that they've given me an integrative medicine clinic. I have longer time to talk with patients. That whole list of problems needs a holistic approach, right? So I'm not sure how to do it. I think it's medical providers standing up and saying, I need more time with my patients. Enough of this in and out door. It's not really serving them. Sure, we're getting some things done, and those things need to get done. Please get your pap smears. Please get your mammograms. And yet there's so much more to health.
I agree. Megan, did you want to jump in on that?
I think it's so challenging. And a lot of times, as someone outside of the insurance model, often I see this such to be such a challenge, this 15-minute model. And I think that what Maria Lisa was saying earlier about group appointments, that really is if it can be facilitated well, if there's someone in the clinic that can support that, I think that is really the one of the ways to get the most messaging with the most women and the most impact, because again, there's cross information, cross talk,
Mhm.
and you can't have a conversation in 15 minutes to talk about a pap smear and your mammogram and everything else that's happening in your body. And bringing in nutritionists and health coaches and people that can have the time to have the conversation where they can sit for an hour with women on Zoom or in person and walk through all of these things guided by what the provider is focusing on or what they think is important, and helping to give them resources, information, tools, so they can start addressing some of these things on their own. We don't, within a lot of these communities, we don't have access to some of these fancy tools where they can have one-on-one sessions with someone for an hour multiple times in a row to get exactly what they need. So if we can address it in a group or educational setting, then at least we give women information. And I think that that's the most important thing is once women have information, they make better decisions about their lives and themselves. And that's what they need is access to the information so they can choose, and then they can decide what to do and be empowered to take their life or to take their care to the next level.
I appreciate that response. And I think that actually Anu had another question, and I think you just touched on it perfectly. Um, yeah, so we're going to move on to the next questions. Going back to Marilisa, how does simple proactive outreach help your existing primary care team provide better care without adding clinical burden?
Yeah, just putting it out there, putting out the offer through CareMessage, or flyers in the exam room, or talking to patients when I see them in an urgent care visit. That simple outreach of just even saying the word, do you think it could be hormones? Do you think it could be something else? They're just like, "Ah, thank you. Someone wants to talk about that with me, right? So, Anu, even in a 30-minute visit when we're talking about, did you get your Pneumovax, all the vaccines, all the colorectal screening, all the other things, it's so hard to do even in a 30-minute well woman visit. Uh, I think we need better structures. So, group medical visits, putting the word out there, and I'm just going to keep saying it to my patients. And so it's a hook. I used to have patients from 45 to 60. We're lowered it to 40 to 60, and now it's going down to 35. So yes, this change happens even sooner.
Amazing. Anu asked if she could talk for a minute. I'm not sure I could bring you on stage just yet, but if you'd like to type, that would be awesome. And then towards the end, I could probably try and bring you up stage. I just got to play around with my settings. Um, okay. Thank you so much. Megan, how have you created I know the ways since I've known you for quite some time, but I just want to know, and I want the rest of the world to know how you've created impact as a solo practitioner.
Sure. I think the biggest thing is figuring out group sessions and community education. So a lot of what I've done is partner with local businesses and places that have lots of women coming as a touch point, doing education that way, where we sit in a circle and have information where I'm sharing, educating, and there's a back and forth with questions and answers. And then finding the right partners to do group sessions with. And that's challenging because it's not about finding someone who's interested and willing to share their expertise and their time. It's finding someone who's willing to administrate, and to what Mary Lisa was saying about better structures. The administrative piece of this is so important because the person who is at the front desk, who is interacting with the patients, is the person who's going to make this successful. So if they're on board and they're focused on this, and we can fill the groups, we can educate women, let them know, put flyers up, give them information on when things are happening. That is the best way that I have found, from a one-to-one, or like as a solo practitioner, to be able to go and do these group sessions. But that administrative piece is so hard to execute. And I think that the other piece of this is working with partners where nutrition and lifestyle are integrated into part of the care plan. So clinics that I work with, that they integrate, it's not an add-on. So it's seeing me as part of the care that you're getting. So you have to come, which some people don't want to come. A lot of people are like, I don't want to see a nutritionist, but we do have a lot to offer in this part of life. And it's not something extra. It's not something that costs more. So I think that that piece really does matter when it's integrated and a part of the overall care that women are already receiving.
You definitely just touched on my next question on, like, how you can model your like, your model your scale inside a clinic. I think just making it part of it, right? And having that ability to have that access to care instead of paying extra and doing all these other different things and jumping through loops. But if you wanna add anything else, please feel free.
Um, no, I think that just that front desk person facilitating everything, and it's such a challenging thing to be on the back end trying to book out these things and seeing the people, talking to them, and often the front desk is who has the most interactive relationship with all of these patients, and so they also, I feel like, play such an important role in this dynamic of getting women access to care.
I totally agree with that. my next question for you both, actually. Perimenopause, menopause, it's rarely just about hot flashes, right? It touches on bone density, cardiovascular health, mental health, metabolic function. So, how has focusing on these things helped you uncover other health concerns that might have gone unaddressed? And Megan, we could start with you.
Okay. Specializing in perimenopause has really helped me understand how siloed everything is, the systems in our care. And so the amount of women that come to see me with this laundry list of doctors that they've been to in the past year with testing and symptoms. And to me, when I zoom out, I can clearly see this picture of perimenopause. And it's just mind boggling how hard it is for those dots to be connected for the patient. And so, from my perspective, when I'm working in the diet and lifestyle place, helping them to figure out that these things are connected. And then sometimes it's gently suggesting that this could be perimenopause and giving them tools on how to bring this conversation up with their provider. Which provider can they speak to? Because it's not always the same person, and they have to understand that just because they have a really amazing OBGYN that's been taking care of them since they had babies, it doesn't necessarily mean that that person is going to be the person that's going to provide care for them in the next step. And that's hard to understand because you don't always understand everyone's medical specialties and what they do. So I think that that is a big piece of how we care for that. And then taking all of those things that are happening and addressing them. So thinking about the brain fog, the lack of focus, energy, chronic UTIs, yeast infections, sore muscles and joints, gut issues. They're not classic symptoms of perimenopause, but they're very common. And if you have time to have a conversation with women, you can suss these things out because in their heads, they're not necessarily connected. And so talking about that space to sit down and have these conversations where we can see what's going on, and you can ask follow-up questions about all of the other parts of their lives, because that's when you find out, oh, I've been going to the gym and my body is super sore and I can't work out like I used to, or I went and got this DEXA scan and my bone density is terrible, and that's not related to what's going on with my gut health, and all of a sudden, I'm constipated and I am bloating and this has never happened before. So it takes time to get all of this information out of women and to let them know that all of these things are connected and it's not just about hot flashes.
All the things you mentioned make me so nervous because my mom started perimenopause at 39 and I'm 32, and I know that they say, like, sometimes it can go on earlier as the generations go, and I'm like, "Oh my gosh, you're seeing so many things," and I'm like, "Maybe I gotta get myself checked out." Marilisa, same question for you, though. How is focusing on these different items help you uncover other health concerns, that might have gone unaddressed?
Yes. So, Alexis, no fear, right? This is normal biology. We are starting to know this more now, right? So, when a woman comes to me, she's had, 5 different urine exams because she thinks she has a UTI, and the cultures come back negative. It's not a UTI. She has atrophic vaginitis. It's dry down there. When I see that, I start thinking, of course, rule out the UTI, rule out vaginal infections, but can we start to talk about menopause? When I start to see a woman's blood pressure go up, when I start to see the cholesterols going up, I wonder their vascular flexibility. What is the effect of their estrogen changes on their heart?
Mhm.
When a woman starts to talk to me about, I can't handle stress like I used to. I used to be able to multitask and do all these things. One, don't multitask so much. But right, when I hear that, I think, how is their sleep? Right? And so all the things that are related, these are all signals that the body is telling us, listen to me, hot flashes, check out my cardiovascular status, right? The gut bloating, doc, I'm bloating. I can't eat what I used to eat before. Let's talk about that. And why is that changing? Why is your body changing? Our bodies changed in puberty when we went from boys, like kind of stick figure, and maybe estrogen gave us hips and breasts and, hair and periods. Estrogen gave us, if pregnancy chooses us or we choose pregnancy, gave us a beautiful baby and, the breasts and the belly bump and the luscious hair. Maybe breastfeeding, right? That estrogen does all those wonderful things. What happens when it starts to decline? We know what happens when it builds up. We are doing more research now, right? A lot of research has been based on men mostly. And I can't remember who said it, but women are not just curvier, smaller men. Our physiology is so much different. And as we learn that, as we learn what it takes as the estrogen goes down, what are the effects on the body and how can we mitigate it? You are not doomed, right? This is our second adulthood. We can reframe. When we talk to pregnant women, how can you eat better for your child? Women are motivated. Quit smoking, not stop drinking, not doing drugs. How can you build? How can you nourish a better baby? In our second adulthood, in perimenopause and menopause, can we learn how to nourish ourselves? Not just our body, our bones, our brain, our sleep, our gut, our GYN, all of that, but it's also the soul empowerment, standing in your power, not allowing a lot of the boundaries to be crossed. This is a great time to learn things. Yes, right? That we are not broken. There's nothing wrong. We're stepping into our new bodies. And can we embrace that? Can we feed it the right way to support our bones so we're not having hip fractures? So we're not having the heart attacks and strokes because our estrogen went away. How can we support all that? Love it. It is a whole person approach.
It really is. And with that, Megan, did you have anything to add to that as well?
No, I think that she just touched on a lot of those things. I think that all of that really matters.
Totally agree. I the boundaries part, I mean, I think that's been such a common thing that I've been hearing more and more lately, establishing boundaries, getting back in touch with yourself. And so I'm really glad that you mentioned that. Are there any clinical findings? And I think you kind of touched on this before, but are there any clinical findings or referral patterns that's emerged from like the outreach that you've been doing or the sessions you've been doing, Marilisa?
Hmm. Referral patterns. So, there's so much to do and so much to talk about. I refer back to my primary care providers. I refer back to my OBGYNs. Hey, I've already talked to this woman about perimenopause and menopause. Can we start to talk about what are the things we need to do to make sure she can safely be on hormones? What are the things we need to do to make sure that her medicines for depression and anxiety can maybe be optimized for her menopausal transition? Um, and like I said earlier, just I'm needing to reach to younger and younger women. Um, After pregnancy, the pregnancy surge of estrogen goes to like 30, 40,000, right? Menopause is at zero. But after the 12-month of pregnancy, and if you're breastfeeding, sometimes it can dip lower than postmenopausal. Like if you're having baby after baby breastfeeding and going back to work, your estrogen is so low that you can be having these patterns. So yeah, I'm finding I need to reach out to younger and younger women, get them on board now, educate them now.
I didn't even know that, by the way. I'm just like,
Yes,
oh, good to know.
yes.
um, and Megan, what does the research say about like long-term consequences of leaving perimenopause unaddressed? And what do you wish more women knew?
So my focus is really heavily on metabolic health because that is what we can affect a lot with diet and lifestyle changes. Heart disease is the number one killer of women in the United States. So we know from the SWAN cohort that women, as we age, become more insulin resistant, and that is independent of age and weight. So that means that the hormonal transition is actually accelerating this insulin resistance. Insulin resistance is associated with worse vasomotor symptoms. And we also know that insulin resistance feeds into metabolic syndrome, hypertension, dyslipidemia, bone health, quality of sleep, mental health. So for me, the foundational pillar that I really wish that women understood is managing their blood sugar because it affects pretty much every area of their health and well-being. But for a tangible takeaway, if they're balancing their blood sugar, then their moods are going to improve. Their sleep is going to improve. Their energy levels will be more stable. Their immune function improves. Their digestive health improves. So all of these things are connected, and it's this one piece that I try to slot in with women at the beginning, even before we fully get into a perimenopause conversation, because that affects so much of their day-to-day life and how they actually show up in the world. And I think that that's something that really moves the needle for them.
100% agree. And lastly, what for clinics that are focused mainly on PAPs and mammograms, um, or just a nutritionist starting to carve out like perimenopause focus, what is one thing that the both of you would tell them to do first? And I'll start with you, Marilisa.
Hmm. Educate your providers first. Um, a lot of folks are not practicing good perimenopause menopause care. We don't know about it. It is not talked enough. It is starting to, but when you educate the providers, they can see the patterns. If you put the word out there, can we just talk about this? So thank you, CareMessage, for even having this. We need to just talk about it. Put the word out and see what ripples out.
Appreciate that. Thank you.
Yeah,
And Megan?
I would say the number one thing that I would tell anyone is to listen to the woman sitting in front of you. Believe her experience, believe her symptoms, believe her pain. She's not making things up, and she is sharing her real life experience in her body. And the most valuable thing that you can do is listen to her and not dismiss her. Beyond that, remembering that there are estrogen receptors in every single cell of the body. So we don't have the full research that we need on perimenopause. So every time that something shows up and a woman says, hey, once I got started taking care of this part of my perimenopause journey, these other things got better, or these really strange random symptoms that I didn't think that were related at all are. Believe her, they probably are. If they all of a sudden their GERD and their got issues resolved, or their skin issues resolved, or their hair gets better, they had weird ear itching that all gets better when they start being taken care of for their perimenopause. I think that that's really important in remembering that there is no textbook perimenopause. It shows up different in every single woman in every body, and patterns are what we have to work with. So believe her, and then help her solve these issues by looking for the bigger patterns that you can help her understand, and how to slot in the care that's going to serve her the most.
I'm gonna give you like poetry snaps for that because that's so valid.
totally.
We have 1 minute left, and then Kendria, I'm sorry if I'm mispronouncing your name, but they asked, "What is recommended for low estrogen levels if women is breastfeeding? If a woman is breastfeeding?" Whoever wants to take that, feel free.
I will jump onto what Megan said, also about the diet and nutrition. So there are lots of foods that have natural estrogen in them, right? Sweet potatoes, soy, tofu. Um, there are those kinds of foods. But I also think just sleeping, the
Yes.
cortisol that goes haywire with the hormones, right? If we can focus on our sleep hygiene so that we're not scrolling right before bed, the doom scrolling before bed is not going to help, right? Much like if you're breastfeeding, the sleep hygiene you give for your baby, rocking them, bathing them, making them warm, turning down the lights, reading a story, putting on music. Can we help our sleep so that our hormones bounce back a lot faster? That and a lot of nutrition.